What is the second step in the M.A.R.C.H algorithm for trauma injuries, and why is it important? The answer to this inquiry lies in the crucial letter A, which stands for Airway. The reasoning behind its secondary position to massive hemorrhage is simple. A person can survive without oxygen for a much longer duration than with a life-threatening bleed. After treating massive hemorrhage, the first action is to ensure that the airway is open with no obstructions. The techniques employed to open the airway depend on the situation and level of training. However, there are some basic methods to follow. The first task is to verify if the person is breathing. This can be done by checking if the person is alert and speaking, and if their chest is rising and falling. If the person is not breathing and is unresponsive, basic airway techniques such as the head tilt chin lift technique or the jaw thrust technique can be used, especially if a neck or spinal injury is suspected. Advanced tools and techniques that allow a highly trained provider to secure the airway and help the patients breathe also exist, such as the nasopharyngeal airways, oropharyngeal airways, surgical airways, and more. Once the airway is open, assisted breathing methods are followed, such as CPR rescue breathing or using a device like a bag valve mask. These methods use positive pressure to push air through the airway and into the injured person's lungs to help oxygenate red blood cells. These steps, although simple, can make a significant difference in the survival of a trauma victim. Prepare yourself and your team with trauma kits that help you when you treat patients following the M.A.R.C.H algorithm by checking out our selection at ussafetykits.com. Stay prepared and stay safe.